Member for Abao.
Thank you, Deputy Speaker. My question without notice is directed to the Minister for Health. This is in relation to the Minister's response the other day with regards to the overcrowding in our premier hospital, the Port Moresby General Hospital. And I've got 3 short questions, plus a suggestion for the good minister. Number 1, in 2 of minister's public statements, and again repeated it yesterday when he was responding to the questions, he labeled Port Moresby General Hospital as level 6 3 times. And it's on Hansard. I want to ask the question, has the minister relabeled Port Moresby General Hospital to a regional referral hospital, which is the current definition of level 6 hospitals? And therefore, he is confusing himself and the entire health ministry. So he is thinking that all regional, southern region patients should be referred to the Port Moresby General Hospital. Can the minister advise the country, has he changed the categorization of the nation's referral hospital, which is level 7, and that is Port Moresby General Hospital? Number 1. Number 2, it is well noted, and doctors have complained, 2 senior doctors have complained of no beds in the Port Moresby General Hospital, both a specialist surgeon and a specialist obstetrician. Surgical and obstetric beds are sought in Port Moresby General Hospital. The question is, has the minister and his department done a study on the actual cause of the shortage of beds at the surgical as well as the obstetric divisions of the Port Moresby General Hospital? If so, what are the results of that study? Because the information that I have shows that in terms of what we call category 3 patients, and these are the ones that don't need specialist doctors. In terms of the emergency department, category 3 patients fill up the Port Moresby General Hospital by 60%. And PMGH did a undertaking, for example, to do a clinic at 6 Mile for emergency for 24 hours. When that happened, according to the survey, 60% of emergency cases, which is usually surgical, emergency cases dropped by 30% just by opening 6 Mile emergency services for 24 hours. Has Minister got that information? If so, the implications are, and the governor for NCD was turning up to help the minister yesterday, but the Deputy Speaker, you said there's no provision for anybody to help anybody on the floor of Parliament yesterday. That means that the answer lies in the National Capital District Provincial Health Authority. Has the minister got those figures corrected? So that's emergency. For obstetrics, the normal deliveries occupy 90% of PMGH delivery beds. Is the minister aware of this study? 90% of PMGH delivery beds are occupied by normal deliveries that don't need a specialist hospital case. And so, Mr. Speaker, can the Minister acknowledge that there was a NEC decision in September 2025 where the decision to allocate about 12 million kina as per the recommendation by the experts to create delivery beds in NCD, Metoreia, Kaugere, 9 Mile. There was a recommendation. Is the minister aware of it? And if that decision is true, when will that money dedicated to create delivery beds in NCD? Because this will immediately resolve this overcrowding in surgical as well as obstetric beds. I think those are the short term, and if the minister can acknowledge that these studies, or if not, if he can get his experts to advise him so that they can move very, very quickly. Cabinet has already allowed NCD PHA to receive that fund last September, but when will that fund be released to NCD PHA so that they can create those beds in the recommended areas? I think they're doing it on Metoreia Clinic already. Kaugere, I think a Minister for Foreign Affairs has to be asked to open that Kaugere quickly. And I think the recommendation is big population is 9 Mile area. For member for Moresby North East has to finish that so that the beds can be created. For the long term, I have a recommendation for the minister to consider, and I will sit down. I think for the long term, Port Moresby City needs a level 4 hospital in Moresby North East, needs a level 4 hospital in Moresby South, needs a level 5 hospital in NCD, needs a level 5 hospital in Central, and needs a level 5 hospital in Goilala, and Central will be in the Hirikwaya electorate. We strongly recommend from the opposition that the government through the minister considers this. This, we believe, will solve the overcrowding both in the surgical and the obstetric wards in PMGH. Thank you.
The Honourable Minister for Health.
Thank you very much, the Deputy Speaker. Firstly, thank you to the member for Abao for these very, very important questions. Port Moresby Hospital was constructed in 1980s, and the capacity was to cater for 300,000 population of NCD, lots of time. Today, fast forward come today, and more than 1 million people established NCD. So that's the reason why the maternity ward section below PMGH that's supposed to be catering for the less number. At the moment, 17,000 babies are born every year, 60 births per day long, maternity ward along PMGH alone. Why it's like I'm up? Because we also no got facilities or lower level facilities like urban clinics along within NCD. The first point about whether the levels today along information of parliament, you got 6 levels of health facilities in the country, 6. Level 1 past time 8 post, now we call him change him along health post. Level 1 before we got 8 post were only like community health worker 8 post was established. Now we got change him along health post, so he can get a triple workman, he can stop inside. Long haul, nursing officer can stop deliver on mama. Level 2, first time we call him a health sub center today. Community health post. You can get up to 5 workmen can stop inside or 10. Level 3, health centers. Level 4, district hospitals. Level 5, provincial hospitals. Level 6 now PMGH, National Referral Hospital. You know what level 6, before level 6 regional hospitals, but because until Nubla Health Service Standards 2021, you got 2030, you got all specialists reviewing this land, all say, need look at the regional hospitals. So you can upgrade more at the level 5 to be able to capture the requirement or need look at all all health facilities in the country. So you look at level 6 more, and level 6 and PMGH now. Level 6 before regional hospitals, no got more now, and level 6 and PMGH stop line. And first, something me like stress him. Under the National Health Service Standards, there's only 6 levels. That's level 6 and national referral, super specialist hospital and PMGH. Port Moresby also got 1,000 bed staff inside, close to 1,500 workman staff inside, but slab. You be fully aware, Noble Health Infrastructure Plan that during my presentation to Parliament this last session, I did present to Parliament the National Health Infrastructure Plan 2025 to 2035, and we reflect him to different levels. Now get the line we have one canal facility by staff one local level government blow you, one district blow you, level 5 provincial hospitals and level 6 staff on time. So on the health plan too, that's what we're doing at the moment. Now the point most of the emergency cases will come PMGH today, overcrowding where you look him is stop online planting is stop floor. Planting low and more suppose you straight him go to all health facilities, lower health facilities by you don't need planting line by going overcrowd PMGH. PMGH at the moment you talk at level 6. They are now supposed to be looking at high level of healthcare in the country. Last year, you must have also successfully delivered kidney transplant last year. Our delivery more than 200 cases, only assisted more than 200 cases long. Before line playing got heart problem, only the procedure angiogram for the first time. Where before one line you can raise him up to 100,000 kina go overseas, relieve him clog arteries blown heart. Today, that can be done at PMGH for the first time. I must have something where you need to allow PMGH to concentrate on high-level healthcare now. The specialized healthcare. You don't need to go to overcrowding or emergency department, kind of same. So that's where we are heading at the moment. We are improving the lower level healthcare facilities. I want to make it very clear. Puka said something about what we're doing lower level. Health facilities lo yumi the NC making decision last year long committee 12 million kina lo improving delivery beds 6 Mile is undergoing renovation Gerayu undergoing renovation Meteor clinic is completed. You got 2 delivery beds stop long up more than mothers are now delivering for the first time outside of PMGH. All mothers are now Olukaram baby lo up na lo Kaugere lo Kwikila by open up this year. I want to thank Minister Chachengo, Minister of Foreign Affairs, working together with the NCD to make sure that we deliver the hospital this year. So these are things that are happening at the lower level of health facilities so we can relieve the congestion and the press at PMGH. I would like to say that we are doing Agivaru at Agivaru is the district, Kariku. There's a facility that I'm opening this year as well, level 3. That we make him longer by relieving all pressure lo PMGH too. Also, we talk to the me play straight him can quick killer for the first time. Or mama can carry baby lo up now. Doctor staff lo up lo Central Province. Me talk thank you lo Minister of Finance. All straight him Malalawa is on tender at the moment. And we improve him again Kerema. So when we do this, look at the segment go big again. Also no need to go to specialized services. You need to free my PMC. That's what today me make him lawyer. So that he can go down the street all low health facilities. So we are fully aware of what's happening. As a Puka, thank you for asking the question. As Central Province, we're working together with the NCD PHA, Gulf PHA. All of us are working in partnership to make sure that they relieve PMGH and allow them to focus on a high level, like cardiac, like cancer. Government committed 200 million kilo fixing cancer facility. For the first time this year, our aim is not to allow or refer anybody who's got cancer go overseas anymore. And government committed 200 million kina, lots of facility. If we complete this particular facility, it's a huge commendation to the government, and we're addressing all these things. To comment on a suggestion made by the member requested what we're doing level 4s. As I said, immediately stretch level 4 facilities NCD. Also supporting Central Province, supporting Kerema, Gulf for PHA, and I want to thank the PHA for Gulf PHA. The chairman there and the CEO have done very, very well. We've been to Central PHA. I'd like to seek the support along respective members of parliament, especially the Central Province, Logo, Quantum, PHS, Plupla, support team, also what's happening. They're doing a lot of good works. I've been to Migolo Tapini, up in the quick Koilala, Migbin Koilala Pinis, now looking all facilities long up. I've been to many of our places in the country. I know exactly what I'm talking about, and I believe we are addressing some of these things. Thank you, Mr. Deputy Speaker.
Governor for Western. Honorable Governor, what's your supplementary?
Supplementary, I'm South Platasol, I'm low Alpi Mamaste, but I'm still not talk out. So, me like ask him, Minister of Health also, when I'm plan level 5 belong NCD, level 5 belong Central Province, level 5 I think also from Gulf Province. Because problem of PMGH, apart from Olgada and Kadim, this hospital saved the, 2 provinces plus our capital city. So it's already overwhelmed stretch. So let me ask me, when I'm plan there's a level 5 hospital, there's a Gulf Province, Central Province, you mean launch him 2021 or 2022? Na NCD, mitubla minister yet, mitubla launch him, I think, 1 year ago, na mitubla wait yet stuff. So, ina be kandim to clear so that everybody knows. Because now PMGH is become a national referral and teaching hospital. It serves the entire country too. And we expect that hospital to be there for everybody. Now, you may not provide him, clear pathway to relieve the burden in Port Moresby General Hospital. Help him me platoon PHA below NCD. That's all.
Honorable Minister for Health.
Thank you, Deputy Speaker, and thank the Governor for NCD for this important question. Level 5 NCD, level 5 law NCD. Is National Health Plan covering level 5 law NCD Central Province na Gulf Province to one time. And first, talking about level 5 is big facility. We're fully aware of the need to actually fast track this particular infrastructure. But me like asking also, there's issues with land that we need to really sort out properly. Speaker, Mr. Deputy Speaker, me like talk today also, our bureaucracy. Bureaucrats blow you side blow treasury, line blow you works, department of like my own department. We need to really work fast on some of these things. Some of the time me talk low, move fast, sit down area, make all meeting, fast track. Many of our bureaucracies are very, very slow. They are very slow in moving things. We can talk and ask them to have meetings, and we need to really force them to have meetings. There are people who are willing to support us and move things fast, but me appeal also all bureaucrats blame me. I want to thank the Prime Minister now. There's a coordinating team at this department to make sure that we move things fast through the Chief Secretary calling the heads. It's just quite difficult to actually get the bureaucrats coming together to hold meetings and move things fast. That's what I'm seeing at the moment. It's actually frustrating to Mr. Deputy Speaker. Level 5, actually, there's a lot of meetings going on, and we need to move things a bit faster. Central Province, long NCD. Central Province do one kind. There's all of these things. Our Department of Health is working with the team now. You may establish them all respective working committees, work on them all team. But then there must be like ongoing meetings every week so that we are fully aware of what's happening. We like to go them. That was something. So to say actually, the design is we actually delayed in this clinical service plan for some time. Maybe complete now. The design is in place now. The land is secured now. It's now the finance to actually establish the kind of source of funding that must come through so that we can fast track some of these things. For Central Province, one kind, the design is in place. It just delayed one in some issues with the land, some of those things. But then maybe it's now long. Fast track is something. I want to, in this particular question, talk to Olsema. I want to say today that we need to review the procurement process law, or side law health. Medical supplies that come through the normal procurement process blooms that take him close to 6 months or 1 year to make a decision. in terms of critical health infrastructure, that decision must be made very quickly. Everything else is going through the same line of procurement arrangements that we can actually wait for months and months. May appeal also, this is some of the time we can reassess, review how we procure the procurement process, health sector, fast-tracking medical supplies procurement, health infrastructure procurement to do or follow another different lane so we can fast-track particular things. Thank you, Deputy Speaker.